Cases of HIV are rising across Canada. In Manitoba, public health officials are warning cases are on track to more than double this year. 189 cases detected in the first 6 months of 2025. In Saskatchewan, the rate of infection is more than 3 times the national average, with nearly 20 cases per 100,000 people. For a look at what's driving this trend is Shamin Mohamed Jr. He is the founder of LetsStopAIDS. That's a youth-led HIV charity. Welcome.
Thank you, Anne-Marie.
In Canada, Indigenous and racialized populations have been particularly affected by those numbers we were just talking about, These big spikes. Why is that happening?
Well, Canada's number as a whole has been rising, still the highest rate of new HIV transmissions of any of the G7 nations. A lot of it comes down to us not really focusing on marginalized, stigmatized, underserved communities in our country. A lot of it comes down to simply just listening. I think if our Canadian government listened a little bit more to communities, we would be able to transform and actually be able to lower new HIV transmissions in our country.
If they were listening, what would they hear? Tell us.
They would immediately hear that there needs to be more meaningful programs and fund community organizations to be able to make the change. There's some real life examples, like there's a young person who's 1 hour away from Winnipeg who's working a low wage job and they need to be able to get access to testing. They finally find the time to go there and they immediately get discriminated for doing that. They'll never go back to get tested again. And by most likelihood, if they do end up becoming HIV positive, they'll never be able to go for services because of that stigma. This is where informed, community-based and community-driven change is actually what's going to move the needle and lower new HIV transmissions in our country.
While cases are not dropping in every single country worldwide, the overall trend is that cases of HIV has fallen nearly 22% from 2010 to 2021 globally. But Canada is this outlier. Why is it that so many other countries are continuing to control the spread and we are not?
So it's devastating, and a lot of it is on our ability to continue to fund organizations to do this meaningful work. But let's put it into context. Like Saskatchewan is more than 3 times our national average. In Manitoba, the rates from 2020 to 2023 went up more than 40%. These are not small numbers of increases, and a lot of that really stems from the simple fact of us not innovating our programs and our ability to think about prevention, care, and treatment as something that's part of our now there's other issues we can go into about, like, just family doctors, access to care, telemedicine. All of these things need to be reachable and accessible. And the minute we stop thinking about that Canada is a local and a global community is when we realize that something that was absolutely preventable can quickly become a global health crisis for our country.
When we look south of the border, the U.S. withdrew from global efforts aimed at combating the spread of HIV, effectively ending 2/3 of all international financing for HIV prevention. That's a huge number. UN AIDS reports that as a result, the world has seen an additional 6.6 million infections. So how confident are you that the global decline in HIV cases will hold with the U.S. pulling 2/3 of its funding?
HIV rates will rise. Like, there was recently an article in the New York Times where there's Peter Donde, a 10-year-old born with HIV. With the USAID funding cuts, he has sadly passed away. He's died. Now, this story is going to continue to happen with funding cuts. If the Canadian government retracts funding to UNAIDS and the Global Fund, we'll continue to see more global deaths. There'll be 6 million preventable deaths will happen. 2,000 new HIV infections will continue to happen every day. Now, in Canada, we've had 75 HIV organizations urge the Canadian government to maintain their funding towards UNAIDS and the Global Fund and maintain their domestic support towards our programming. If we see Canada as a global community and and with a local force, and we need to see this as a connected space.
I want to end our conversation where we started, which is taking a look at this country. We did reach out to the government of Manitoba to ask what they are doing in response to the spike of HIV cases there, because healthcare is provincially managed. The province pointed to more than $8 million that it has invested since 2023 on HIV prevention and intervention initiatives, including removing barriers to accessing medication, funding for Aboriginal health and wellness centres, mobile healthcare, and wellness clinics. It also added this. In 2024, the province created an interdepartmental HIV response team comprised of executive leadership from the Departments of Health, Seniors, and Long-Term Care, Housing, Addictions and Homelessness, Justice, Municipal and Northern Relations, and Finance to support cross-departmental planning and implementation of initiatives that addresses HIV in Manitoba. So that is their statement. How do you respond to the list of measures they say that they're doing now?
It's not enough. You need to listen more. People are going to continue be seroconverting to become HIV positive if you don't listen to communities. If you don't listen to Black, Indigenous, other marginalized, criminalized communities, we will continue to have a rising rate of new infections in our country. And this will not just become, I was here last year and we spoke about one province. Today we're speaking about 2 provinces. I'm really scared about what we'll be speaking about in the future. Let's take action on our domestic funding and support our Canadian work. Let's take action on our global efforts to be a global steward and lower new HIV transmissions globally. We have the ability to do this. Let's continue to urge our Canadian government to see the ability that right now we're at a state we can actually prevent this from becoming a global health crisis.
And
again.
we know that because we've done it before. We need to get back there again. Shamin Mohamed Jr., always great to have you here. Thank you for coming back.
Thank you.
I just want to note that we also reached out to the government of Saskatchewan to see how that province is responding to the spike in cases of HIV, but we did not receive a reply in time for this interview.